Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I've been a cardiologist in Houston for more than 40 years. The focus of this presentation is on what is palpitation or fluttering or any uneasy sensation in your chest other than chest pain. Should you be concerned about it? What you need to do. So we're going to cover all these things. So let us continue with the feature presentation. As I said, I have been a cardiologist for more than 40 years and having seen several thousand cardiac patients, I can summarize the main reasons why patients see cardiologists. The first one is, of course, chest pain. Chest pain is related to reduced circulation to the heart muscle itself by blockage of the arteries supplying the heart muscle. By blockage of the arteries supplying the heart muscle, that is known as the coronary artery disease, which leads to chest pain or angina as it is called, and eventually when there is total blockage it can lead to a heart attack. This accounts for almost 90 to 95% of the patients we see in our practice. About 30% of the patients we see in our practice also have palpitations, like they feel extra beats or thumping of the chest or rapid heartbeats. And those are related to the electrical abnormalities in the heart leading to rapid heartbeats or extra heartbeats as they are called, which is going to be the focus of presentation. The third most important symptom why people come to see a cardiologist is known as shortness of breath. Most of you are familiar with shortness of breath. Let's say you were able to walk for a mile without having any shortness of breath or fatigue. Now all of a sudden, when you walk half a mile, you feel like you're running out of oxygen. That's what people feel like if you're running a marathon. So your body is not able to keep up with the demand for any number of reasons, and that can lead to shortness of breath. The shortness of breath is generally in the older population related to what is known as the heart failure, where the heart muscle becomes enlarged, becomes weak, and is unable to meet the oxygen demands of the heart. So let us focus on palpitations in this presentation. We have a separate presentation on chest pain evaluation itself, and I will make a separate video on why people get short of breath, because there are a number of reasons besides heart where people can get short of breath due to congestion in the lungs, pneumonia, chronic obstructive lung disease or COPD, and a whole host of other things. So let us continue with palpitations. Generally, the human heart beats at a range of 60 to 100 beats per minute, which is controlled by what is known as the sinus node that generates the impulse. If, for any reason, the heart generates an extra impulse that can arise from any part of the heart itself, from the atria, from the ventricles, or any one of these electrical fibers, it is called an extra beat, which is known as a PAC if it comes from the upper chambers, PVC or premature ventricular complexes if they come from the lower chamber of the heart. But when they happen more frequently, like 10 to 15 beats per minute, people begin to feel this palpitation. They feel like their heart is flip-flopping. There are a number of reasons in which people describe these symptoms. But before we get into the symptoms, we need to look at what is causing these extra beats. The most important things in a younger population we need to be concerned about are, of course, smoking. Smoking can irritate the heart, and that can cause extra heartbeats. Caffeine. And you see people having all kinds of high caffeine containing drinks, and they start feeling palpitations after that. Or drugs, either prescription drugs or street drugs like cocaine, marijuana, they can stimulate the heart and create irregular heartbeats. And of course, the most important one is the structural heart disease, that is where there is something abnormal within the heart muscle itself or the electrical system. There could be problems in the heart valves, there could be problems with the electrolytes like potassium, magnesium, which can cause irregular heartbeats. And of course, hyperactive thyroid is another common cause of rapid heartbeats. When we are talking about palpitations, it could be just extra heartbeats, or it could be a variety of irregular heart rhythms. And here we see an example of a rapid, here's a normal rhythm, which is like 65 per minute, and all of a sudden we see a rate going at 150 beats per minute. That's where you feel the racing of the heart. And some of the symptoms described by these patients include like palpitations. You feel like your heart is flip-flopping. You feel like your heart is stopped and then it starts again, then it stops, it starts again, and sometimes it speeds up. And you can feel like a fluttering in the chest, like you're holding a bird in your hand. You can feel the bird's feathers flutter, and you can feel the same fluttering sensation in your chest. And as I said, you can feel the heart racing like you run a marathon or a 100-meter sprint. And you can see some people describe this, it felt like my heart was going to jump out of my chest. And these are some of the things they explain. And some of patients may, because of the rapid heartbeat and because of reduced cardiac function during these rapid heartbeat periods, they can develop dizziness, or even people can pass out if they have a heart rate that is too fast. And that's what happens during a cardiac arrest. When the heart ventricles are going at 300 beats per minute, it is not pumping any blood, and that's when they pass out, and that's called the cardiac arrest. But we are not going there today. We are just talking about simple palpitations that you feel in an everyday situation, and what needs to be known about them and what you need to do. Some of the tests we do to determine what is causing these extra beats could be very simple, as just taking a history and an electrocardiogram. If you're having 1 or 2 extra beats per minute, it may not be anything significant. But we may also do an echocardiogram, which looks at the structure of the heart. As I told you, structural heart disease is one of the most common causes of these extra beats or rapid heartbeats that you feel as palpitations. We do blood tests to look for electrolyte abnormalities like low potassium, low magnesium, or calcium abnormalities. Then we do a stress test to see if we can bring out these extra heartbeats or rapid heart rhythms. Thyroid test to look for any evidence of a hyperthyroid function. And generally we put a monitor, like a 24 hours, 48 hours, or 2 weeks. And there are other things available like loop recorders, which can continuously monitor your heart rate for like 2 to 3 years at a time. Or when you have a pacemaker, your heart rate is continuously monitored. It may not be monitored live, but it is all stored in the memory of that pacemaker battery, so that when we do a pacemaker check every 6 months, we can see what has happened to your rhythm during the past 6 months or since the time the pacemaker was put in. Then in advanced cases where people have real rapid heartbeat like 150 to 200 or 250, then we do electrical testing of the heart to see where these extra impulses are arising, and we may be able to freeze those areas and sometimes eliminate these extra beats arising from the atria, which is most commonly known as atrial flutter or fibrillation, or from the ventricles, which is known as the ventricular tachycardia. Okay, here are some examples of extra beats or palpitations. Here we have normal beat, extra beat, normal beat, extra beat. So we have like frequent, these are called premature ventricular complexes. And this is an example of a rapid heartbeat, which I already showed you at a rate of 150, which terminates, and then the normal sinus rhythm resumes. And sometimes the heart rate can be very fast, like 250 to 300 beats per minute, during which time patients may feel extremely dizzy, and as I said, some people may pass out. And All these things can be determined by the tests that I was talking about, all these tests that will help us to pinpoint the type of irregular heart rhythm, the rapidity of the heart rhythm, the origin of the heart rhythm, so that we can tailor make the treatment as far as controlling them with medications or electrical ablation or freezing as it is called, or even doing surgery in certain cases to eliminate these rapid irregular heart rhythms, especially like atrial fibrillation. It is called the Mayo procedure that is done during a heart surgery done for other reasons. So ladies and gentlemen, what is the prognosis of someone having these extra beats? Should you be concerned about it? Definitely you need to be concerned about having these extra beats, because these extra beats, until we define what they are and how frequently they are happening and how they are affecting you, we do not know what exactly we are dealing with. That's why I think an evaluation by a cardiologist is of paramount importance in trying to determine what is the nature of the irregular heartbeat or the rapid heartbeat that you are having. Is the rapid heartbeat you are having, is this intermittent or is it permanent? Is there an underlying heart disease? And can this be controlled with medications? There are thousands of people who have these extra beats who can be very well controlled with medications and lifestyle changes, which I'm going to talk about, which you may not like it, but it will help to minimize these symptoms, minimize hospitalizations, and help you get back to your normal life. And of course, if there are electrolyte imbalances, especially if you are already on heart failure medications, it is not uncommon to see low potassium or magnesium, which needs to be constantly checked and readjusted. Kidney function plays an important role in terms of how the cardiac drugs function and how it can cause these electrolyte imbalances. Now we finally come to your role as what you need to be doing to minimize these palpitations or extra heartbeats. First of all, you need to make sure you remove all stimulants, caffeine, alcohol, or any drugs that you're taking may be causing these arrhythmias. In fact, many drugs that we use to control these rapid heartbeats can also themselves trigger other kinds of rapid heartbeats. And that's something which a specialist can identify and treat that. So ladies and gentlemen, this is a quick synopsis of what is palpitations, how people experience it, what causes it, and how we diagnose and pinpoint the cause and the location of these rapid heartbeats, and how we can totally eliminate them in most cases, if not control them with medications. Thank you so much for watching this presentation. We have numerous cardiology related topics on our YouTube channel. Please do watch them. And in the next presentation, I'm going to talk about shortness of breath. What does it mean? What are the main causes of shortness of breath, and what you need to be concerned about related to shortness of breath. Thank you so much, and please do subscribe to our YouTube channel, and I will see you in the next presentation.